Question 1. Strategic planning requires a certified preventive functions dental assistant, CPFDA, to meticulously evaluate a patient's oral structures. When assessing a new patient presenting for a routine examination, which of the following actions best demonstrates adherence to the CPFDA regulatory framework concerning dental arches and occlusion? Option A. Assuming a standard normal occlusion based on the patient's age and general dental health, and proceeding with routine preventive instructions. Option B. Documenting the relationship between the maxillary and mandibular arches, identifying the type of occlusion e.g. Class I, Roman II, Roman III, and noting the congruence or discrepancy between centric relation and centric occlusion. Option C. Focusing primarily on the patient's stated discomfort and visually inspecting the teeth for obvious signs of wear or damage. Option D. Recording the general curvature and alignment of the maxillary and mandibular arches, noting any obvious crowding or spacing. The correct answer is B. Documenting the relationship between the maxillary and mandibular arches, identifying the type of occlusion e.g. Class I, Roman II, Roman III, and noting the congruence or discrepancy between centric relation and centric occlusion. Explanation. This scenario is professionally challenging because accurately assessing and documenting a patient's occlusion is fundamental to providing effective preventive dental care. Misinterpreting or failing to properly identify occlusal relationships can lead to incorrect treatment planning, inadequate preventive recommendations, and potentially exacerbate existing dental issues. The Certified Preventive Functions Dental Assistant (CPFDA) role demands a thorough understanding of dental arches and occlusion to support the dentist's diagnostic and treatment efforts. The correct approach represents best professional practice because it directly aligns with the CPFDA scope of practice as defined by regulatory frameworks governing dental assisting. This involves a systematic and accurate assessment of both the maxillary and mandibular arches, identifying the type of occlusion e.g. Class I, Roman II, Roman III, and critically, determining the relationship between centric relation and centric occlusion. This detailed assessment allows for precise documentation, which is essential for tracking changes over time, communicating findings to the dentist, and developing targeted preventive strategies. Adherence to these established protocols ensures patient safety and quality of care, fulfilling the ethical and regulatory obligations of a CPFDA. An incorrect approach that focuses solely on the general shape of the arches, without detailing the occlusal relationships, fails to meet the diagnostic requirements for preventive care. This oversight can lead to missed opportunities for early intervention in occlusal disharmonies that could contribute to wear, temporomandibular joint, TMJ, issues, or periodontal problems. Ethically, this represents a failure to provide comprehensive care within the scope of the CPFDA responsibilities. Another incorrect approach that prioritizes only the patient's chief complaint without a thorough occlusal assessment neglects the underlying biomechanical factors that may be contributing to the complaint. While patient comfort is paramount, a complete occlusal analysis is necessary to understand the root cause of many dental problems. Failing to conduct this assessment is a regulatory failure, as it bypasses a critical diagnostic step expected of a CPFDA. A third incorrect approach that assumes a normal occlusion without objective assessment is also professionally unacceptable. Occlusion is a complex interplay of many factors, and what appears normal at a glance may have subtle deviations that are significant for preventive planning. This assumption can lead to a lack of necessary preventive measures, potentially allowing minor occlusal issues to progress into more serious conditions, which is a breach of professional duty and regulatory expectations. Professional decision-making in such situations requires a systematic approach. First, understanding the specific requirements of the CPFDA role and its regulatory boundaries. Second, forming a comprehensive assessment of the patient's oral structures, including detailed evaluation of dental arches and occlusion. Third, accurately documenting all findings. And finally, communicating these findings clearly to the supervising dentist to inform treatment and preventive planning. This process ensures that all relevant diagnostic information is gathered and utilized effectively for the patient's benefit. Question 2. The efficiency study reveals that dental assistants are spending an average of 30 seconds per patient on hand hygiene between procedures, and the study suggests reducing this to 15 seconds to improve patient throughput. Considering the principles of infection control and standard precautions, What is the most appropriate course of action for a certified preventive functions dental assistant? Option A. Implement the reduced hand hygiene time as recommended by the efficiency study to improve workflow. Option B. Discuss the findings with the dental team and consult current infection control guidelines to determine if a shorter, yet still effective, hand hygiene protocol can be safely implemented. Option C. Inform the efficiency study team that their findings are irrelevant to clinical practice and should be disregarded. Option D. Reject the recommendation and continue with the current hand hygiene duration, ensuring it meets established guidelines for effective microbial removal. The correct answer is A. Implement the reduced hand hygiene time as recommended by the efficiency study to improve workflow. Explanation. Scenario analysis. This scenario presents a common challenge in dental setting where a perceived shortcut in infection control protocols could lead to significant risks. The efficiency study, while aiming to improve workflow, has identified a practice that directly conflicts with fundamental principles of preventing disease transmission. The professional challenge lies in balancing operational efficiency with the absolute imperative of patient and staff safety, which is paramount in healthcare. Failure to adhere to established infection control guidelines can have severe consequences, including the spread of pathogens, patient harm, and legal repercussions. Correct approach analysis. The correct approach prioritizes adherence to established infection control protocols, specifically standard precautions and proper hand hygiene, as mandated by regulatory bodies governing dental assisting practices. Standard precautions assume all patients are potentially infectious and require the consistent use of appropriate personal protective equipment, PPE, and meticulous hand hygiene before and after patient contact, and after contact with potentially contaminated surfaces. This approach directly addresses the chain of infection by breaking the links of transmission, whether direct, indirect, or droplet. It represents best professional practice because it is evidence-based, ethically sound, and legally required to protect both patients and healthcare providers. Incorrect approaches analysis. Implementing the suggested change without proper evaluation and adherence to guidelines is a direct violation of infection control principles. This approach fails to recognize that efficiency should never compromise safety. It ignores the potential for cross-contamination and the transmission of infectious agents, which is a primary concern in any healthcare setting. This failure to follow established protocols constitutes a regulatory and ethical breach, as it endangers patient well-being and potentially exposes staff to infectious diseases. Another incorrect approach would be to implement the change based solely on the efficiency study's recommendation, without consulting current infection control guidelines or seeking expert advice. This demonstrates a lack of critical thinking and a disregard for the established scientific basis of infection prevention. It is professionally unacceptable because it relies on anecdotal or incomplete information rather than evidence-based practices, leading to potential breaches in patient safety and regulatory noncompliance. A third incorrect approach might involve a superficial understanding of hand hygiene, believing that a quick rinse is sufficient. This misunderstands the critical role of thorough hand washing, or the use of alcohol-based hand rubs in effectively removing or inactivating microorganisms. This superficial approach fails to break the chain of infection and can lead to the transmission of pathogens, representing a significant ethical and regulatory failure. Professional reasoning. Professionals in preventive dental functions must employ a decision-making framework that begins with identifying the core objective, patient and staff safety. When presented with a suggestion for increased efficiency, the first step is to critically evaluate its potential impact on infection control. This involves consulting relevant regulatory guidelines, e.g., OSHA, CDC recommendations for dental settings, understanding the principles of the chain of infection, and assessing how the proposed change aligns with standard precautions and best practices for hand hygiene and PPE use. If a proposed change appears to compromise these principles, it must be rejected or modified to ensure compliance. Professionals should always err on the side of caution when patient safety is involved and seek guidance from supervisors or regulatory bodies if there is any doubt. Question 3. Investigation of a scenario where a patient, during a routine preventive cleaning appointment, asks the Certified Preventive Functions Dental Assistant, CPFDA, if they can get those little sealants put on their back teeth today. The CPFDA has observed that the patient's molars have deep grooves that could benefit from sealants, and the dentist is currently with another patient. The CPFDA has been trained in sealant application as part of their certification. Option A. Inform the patient that sealants can only be discussed with the dentist and that they will have to wait for a future appointment. Option B. Proceed with applying the sealants immediately as the patient has requested preventive care and the CPFDA is trained in the procedure. Option C. Explain to the patient that sealants are a preventive procedure that can protect their teeth from decay and ask if they would like to proceed with having them applied, ensuring they understand it's a separate procedure from the cleaning. Option D. Apply the sealants, assuming that the patient's request for preventive care implicitly includes sealants, and inform the dentist later. The correct answer is C. Explain to the patient that sealants are a preventive procedure that can protect their teeth from decay and ask if they would like to proceed with having them applied, ensuring they understand it's a separate procedure from the cleaning. Explanation. This scenario presents a professional challenge due to the potential for misinterpretation of a patient's consent and the critical need to adhere to the scope of practice for a Certified Preventive Functions Dental Assistant, CPFDA. The CPFDA must operate strictly within the established regulatory framework, ensuring patient safety and maintaining professional integrity. Careful judgment is required to distinguish between providing educational information and performing procedures that fall outside their authorized scope. The correct approach represents best professional practice because it prioritizes patient autonomy and safety by seeking clarification and ensuring that any proposed action is within the CPFDA-defined scope of practice as outlined by the relevant dental board regulations. This aligns with the ethical principle of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. Specifically, it upholds the regulatory requirement for dental assistants to perform only those functions delegated by a licensed dentist and to operate within their certified competencies. An incorrect approach that involves proceeding with the sealant application without explicit, informed consent for that specific procedure constitutes a failure to obtain proper consent, which is a violation of patient rights and potentially battery. It also represents an overreach of the CPFDA scope of practice if sealant application is not a designated preventive function for their certification level in the given jurisdiction. Another incorrect approach, such as deferring the decision entirely to the patient without providing necessary information about the procedure's benefits and risks, fails to fulfill the duty of care and may lead to a patient making an uninformed decision. This could also be seen as a failure to adequately educate the patient within the CPFDA role. A third incorrect approach, forming the sealant application based on a general assumption of consent for preventive care, is a significant ethical and regulatory failure. It bypasses the crucial step of obtaining specific consent for a distinct procedure, thereby violating patient autonomy and potentially exceeding the CPFDA authorized duties. The professional reasoning process for similar situations should involve a clear understanding of the CPFDA scope of practice, the specific procedure being considered, and the patient's expressed wishes. When in doubt, the CPFDA should always consult with the supervising dentist. This involves a step-by-step evaluation. 1. Identify the patient's request or expressed need. 2. Determine if the requested action falls within the CPFDA certified functions and scope of practice. 3. If it does, ensure clear, informed consent is obtained for that specific procedure. 4. If it does not, or if there is any ambiguity, consult the supervising dentist for guidance and delegation. Question 4. What factors determine the accurate identification and charting of a specific tooth's crown and root anatomy, including its surfaces, within the context of the Universal Numbering System, Palmer Notation, and FDI system for a Certified Preventive Functions Dental Assistant? Option A. The precise observation of the tooth's unique anatomical landmarks, including cusp patterns, root furcations, and surface characteristics, combined with the consistent and correct application of a recognized dental numbering system. Option B. Relying on the patient's self-reported identification of the tooth and its perceived condition. Option C. Prioritizing the speed of charting over meticulous anatomical detail to efficiently manage patient flow. Option D. A general visual assessment of the tooth's size and shape, assuming it fits a typical representation within the chosen numbering system. The correct answer is A. The precise observation of the tooth's unique anatomical landmarks, including cusp patterns, root furcations, and surface characteristics, combined with the consistent and correct application of a recognized dental numbering system. Explanation: this scenario is professionally challenging because accurately identifying and documenting tooth morphology is fundamental to providing safe and effective preventive dental care. Misidentification can lead to incorrect treatment planning, charting errors, and ultimately, compromise patient outcomes. The Certified Preventive Functions Dental Assistant, CPFDA, must possess a thorough understanding of tooth anatomy to perform their duties competently and ethically, adhering to established professional standards and regulatory guidelines. The correct approach involves a systematic evaluation of the tooth's physical characteristics, including its shape, size, cuspal anatomy, root structure, and surface features, in conjunction with accurate application of a recognized numbering system. This ensures precise communication with the dentist and accurate patient records. This aligns with the CPFDA responsibility to maintain accurate patient documentation, core ethical and regulatory requirement for all dental professionals. Best professional practice dictates that all dental charting and communication be unambiguous and based on objective observation and established nomenclature. An incorrect approach that relies solely on a general visual impression without considering specific anatomical landmarks or the established numbering system is professionally unacceptable. This could lead to miscommunication and errors in treatment, violating the CPFDA duty of care. Another incorrect approach that prioritizes speed over accuracy, leading to hasty identification and potential misclassification of tooth surfaces or anatomy, is also a failure to meet professional standards and could result in inappropriate preventive measures being applied. Furthermore, an approach that uses an inconsistent or personal numbering system, rather than a universally accepted one like the Universal Numbering System, Palmer Notation, or FDI system, creates confusion and risks significant errors in patient records and interprofessional communication, directly contravening regulatory requirements for standardized documentation. Professional decision-making in such situations requires a methodical approach. First, observe the tooth's gross morphology. Second, identify key anatomical features such as cusps, fossae, and root concavities. Third, apply the appropriate numbering system consistently and accurately. And finally, document findings clearly and legibly. This systematic process minimizes the risk of error and ensures that patient care is based on precise and reliable information, upholding the integrity of the dental record and the CPFDA professional responsibilities. Question 5. When evaluating the instrument processing workflow in a dental practice to identify opportunities for optimization, which of the following strategies would best align with the principles of ensuring instrument sterility and regulatory compliance for a certified preventive functions dental assistant? Option A. Reducing the frequency of preventative maintenance checks on the autoclave to conserve resources, as long as instruments appear clean and functional after sterilization. Option B. Relying on the subjective assessment of staff experience to determine when instruments are adequately processed, rather than strictly following documented standard operating procedures. Option C. Implementing a visual inspection checklist for each stage of instrument processing, from initial cleaning through to final storage, to ensure adherence to established protocols and identify any deviations that could compromise sterility. Option D. Prioritizing the shortest available sterilization cycle times to expedite instrument turnaround, assuming that all instruments are adequately cleaned and packaged beforehand. The correct answer is C. Implementing a visual inspection checklist for each stage of instrument processing, from initial cleaning through to final storage, to ensure adherence to established protocols and identify any deviations that could compromise sterility. Explanation. The scenario presents a common challenge in dental settings, ensuring the efficiency and effectiveness of instrument processing while adhering to strict infection control protocols. The professional challenge lies in balancing the need for timely patient care with the non-negotiable requirement for sterile instruments, which directly impacts patient safety and the reputation of the practice. Careful judgment is required to identify and implement process improvements that enhance workflow without compromising safety standards. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based review of the entire instrument processing workflow. This involves identifying bottlenecks, evaluating the effectiveness of current protocols against established guidelines, such as those from the CDC or relevant state dental boards, which are the governing bodies for CPFDA certification in the U.S., and implementing targeted improvements. This proactive and data-driven method ensures that all steps from cleaning to storage are optimized for both efficiency and sterility assurance, thereby minimizing the risk of cross-contamination and ensuring compliance with regulatory requirements for infection control. An incorrect approach that focuses solely on expediting the sterilization cycle without verifying adequate cleaning or proper packaging would be a significant regulatory and ethical failure. This bypasses critical steps designed to remove bioburden and prevent recontamination, directly violating infection control standards and potentially leading to patient harm. Another incorrect approach that involves skipping routine maintenance checks on sterilization equipment, even if instruments appear sterile, is also a failure. Sterilization equipment requires regular calibration and maintenance to ensure it functions within specified parameters. Failure to do so can result in ineffective sterilization, a direct violation of public health regulations, and a breach of the ethical duty to provide safe patient care. Lastly, an approach that relies on anecdotal evidence or personal preference rather than established protocols for instrument handling and storage would be professionally unacceptable. This introduces variability and subjectivity into a critical process, increasing the risk of errors and noncompliance with documented infection control plans. Professionals should employ a decision-making framework that begins with understanding the regulatory landscape and established best practices for instrument processing. This involves continuous education and staying abreast of updated guidelines. When evaluating a process, the framework should include 1. Identifying the objective e.g., improving efficiency while maintaining sterility. 2. Gathering data on the current process e.g., turnaround times, observed practices. 3. Comparing current practices against regulatory requirements and evidence-based guidelines. 4. Identifying potential areas for improvement. 5. Implementing changes in a controlled manner. And 6. Monitoring the effectiveness of those changes. This systematic approach ensures that all decisions are grounded in safety, efficacy, and regulatory compliance. Question 6. The control framework reveals that a certified preventive functions dental assistant, CPFDA, is performing a routine oral examination on a 7-year-old patient. During the examination, the CPFDA notes that the patient has only erupted 12 permanent teeth, and several primary teeth appear to be significantly delayed in their exfoliation. Radiographic examination shows that some permanent teeth are present in the jaw but appear abnormally shaped and positioned, with evidence of enamel hypoplasia in several areas. The CPFDA suspects a potential developmental anomaly affecting tooth formation and eruption. Which of the following actions best aligns with the CPFDA responsibilities and the regulatory framework for preventive functions? Option A. Document the observed findings, including the number of erupted teeth, delayed primary tooth exfoliation, and radiographic observations of abnormal permanent tooth morphology and position, and immediately consult with the supervising dentist for further evaluation and management. Option B. Proceed with a standard prophylaxis and fluoride application, as the primary focus of the appointment is preventive care, and developmental issues are outside the CPFDA immediate scope. Option C. Inform the parent that the patient likely has a significant dental problem requiring specialist intervention and suggest they seek an orthodontic consultation immediately. Option D. Advise the patient's parent that the delayed eruption and abnormal tooth appearance are likely temporary and will resolve on their own with time, without further intervention. The correct answer is A. Document the observed findings, including the number of erupted teeth, delayed primary tooth exfoliation, and radiographic observations of abnormal permanent tooth morphology and position, and immediately consult with the supervising dentist for further evaluation and management. Explanation. This scenario presents a professional challenge because it requires the Certified Preventive Functions Dental Assistant, CPFDA, to accurately identify a developmental anomaly based on clinical observation and radiographic evidence, and then to communicate this finding appropriately within the scope of their practice. The challenge lies in distinguishing between normal variations in tooth development and true anomalies, and in understanding the appropriate reporting and referral pathways according to CPFDA regulations. The correct approach represents best professional practice because it prioritizes patient care and adherence to regulatory guidelines. By recognizing the potential anomaly, documenting it accurately, and consulting with the supervising dentist, The CPFDA ensures that the patient receives timely and appropriate diagnosis and management. This aligns with the CPFDA role in preventive care and early detection, as well as the ethical obligation to act in the patient's best interest and within the defined scope of practice. An incorrect approach that involves dismissing the finding as insignificant would be a regulatory failure. It neglects the CPFDA responsibility to identify and report potential issues that could impact oral health. This could lead to delayed diagnosis and treatment of a developmental anomaly, potentially causing long-term complications for the patient. Ethically, it breaches the duty of care. Another incorrect approach, such as attempting to diagnose or manage the anomaly independently without dentist consultation, represents a significant scope of practice violation and a regulatory failure. The CPFDA is not authorized to diagnose or prescribe treatment. This action undermines the dentist's authority and could lead to incorrect or harmful interventions. Ethically, it is a breach of professional boundaries and patient safety. A third incorrect approach, such as failing to document the finding at all, is a regulatory failure related to record keeping. Accurate and thorough documentation is a legal and ethical requirement. The absence of documentation prevents proper tracking of the patient's oral health status and can hinder future diagnostic efforts by other healthcare professionals. The professional decision-making process for similar situations involves a systematic approach. 1. Observe and gather all relevant clinical and radiographic information. 2. Compare findings against established knowledge of normal tooth development and eruption patterns. 3. Identify any deviations that suggest a developmental anomaly. 4. Consult with the supervising dentist, clearly and concisely presenting the observations and concerns. 5. Follow the dentist's instructions for further assessment, documentation, and patient management. 6. Ensure all actions are within the CPFDA scope of practice and adhere to relevant regulations. Question 7. System analysis indicates that a certified preventive functions dental assistant, CPFDA, has just taken a periapical radiograph of a posterior tooth. Upon reviewing the image, the assistant notes that the image appears slightly underexposed, with limited detail in the trabecular bone. The patient has a history of periodontal disease, making clear visualization of bone levels critical for diagnosis. The assistant is aware of the regulatory requirement to adhere to radiation safety principles. What is the most appropriate course of action? Option A. Submit the slightly underexposed radiograph for interpretation, as it may still provide sufficient diagnostic information. Option B. Immediately retake the radiograph with the same exposure settings to ensure consistency. Option C. Increase the exposure time significantly to ensure a diagnostically acceptable image, regardless of potential overexposure. Option D. Adjust the exposure factors to increase the radiographic density and detail, then retake the radiograph. The correct answer is D. Adjust the exposure factors to increase the radiographic density and detail, then retake the radiograph. Explanation. Scenario analysis. This scenario presents a common challenge in dental radiography, where a dental assistant must balance the need for diagnostic quality images with the imperative to minimize radiation exposure to both the patient and themselves. The professional challenge lies in accurately assessing the situation and applying radiation safety principles without compromising the diagnostic value of the radiograph, which is crucial for accurate diagnosis and treatment planning. This requires a thorough understanding of X-ray properties and the ALARA principle. Correct approach analysis. The correct approach involves a systematic evaluation of the exposure factors and the patient's anatomy to determine if retakes are truly necessary and if they can be achieved with reduced exposure. This aligns directly with the ALARA, as low as reasonably achievable principle, a cornerstone of radiation safety in dental radiography. By considering factors like KVP, MA, and exposure time, and by evaluating the need for retakes based on diagnostic quality rather than arbitrary standards, the assistant demonstrates a commitment to minimizing unnecessary radiation. This approach is ethically sound, as it prioritizes patient well-being, and is legally mandated by regulatory frameworks governing dental radiography, which emphasize dose reduction. Incorrect approaches analysis. One incorrect approach is to immediately retake the radiograph without assessing the diagnostic quality of the initial image. This violates the ALARA principle by exposing the patient to additional radiation when it may not be necessary. It also demonstrates a lack of critical thinking and diagnostic acumen. Another incorrect approach is to simply increase exposure factors indiscriminately to ensure a better image. This can lead to overexposure, image artifacts, and unnecessary radiation dose without necessarily improving diagnostic quality, and it fails to consider the specific reasons for the initial image perceived inadequacy. A third incorrect approach is to ignore the perceived issue and submit a suboptimal radiograph. This compromises diagnostic accuracy, potentially leading to misdiagnosis or inadequate treatment, and fails to uphold professional standards of care and the ethical obligation to provide quality diagnostic information. Professional reasoning. Professionals should employ a decision-making framework that begins with assessing the diagnostic adequacy of the current radiograph. If the image is diagnostically acceptable, no retake is needed, adhering to ALARA. If the image is suboptimal, the assistant must identify the specific deficiency, e.g., underexposure, overexposure, elongation, foreshortening, cone cutting. Based on this identification, the assistant should then consider adjustments to exposure factors, KVPMA, time or positioning techniques that will rectify the deficiency while minimizing any increase in radiation dose. This iterative process of assessment, identification, and adjustment, always guided by ALARA and diagnostic necessity, is the hallmark of responsible dental radiography. Question 8. The performance metrics show a consistent pattern of the Certified Preventive Functions Dental Assistant, CPFDA, accurately identifying and documenting common radiographic findings, including early-stage dental caries and moderate periodontal bone loss, on routine biodoing and periapical radiographs. The dentist has expressed satisfaction with the clarity and detail of these documented findings. However, on a recent panoramic radiograph, the CPFDA noted a subtle, irregular radiopacity in the mandibular body that was not immediately classifiable as a common pathology. Considering the CPFDA scope of practice and the need for accurate radiographic interpretation, which of the following actions best reflects appropriate professional conduct in this scenario? Option A. Document the subtle, irregular radiopacity in the mandibular body, noting its location and characteristics, and bring it to the immediate attention of the supervising dentist for further evaluation and diagnosis. Option B. Attempt to definitively diagnose the radiopacity as a specific condition, such as a cyst or tumor, based on available online resources, and then inform the dentist of the suspected diagnosis. Option C. Assume the radiopacity is a common anatomical variation or artifact, and proceed with other patient care duties without further comment, as it does not clearly represent a recognized pathology within the CPFDA typical interpretation scope. Option D. Highlight the radiopacity on the radiograph with a marker, and instruct the patient to schedule a follow-up appointment specifically for a radiologist's interpretation of that particular finding. The correct answer is A. Document the subtle, irregular radiopacity in the mandibular body, noting its location and characteristics, and bring it to the immediate attention of the supervising dentist for further evaluation and diagnosis. Explanation. This scenario is professionally challenging because the Certified Preventive Functions Dental Assistant, CPFDA, is tasked with interpreting radiographic images, a critical diagnostic step that directly impacts patient care and treatment planning. Misinterpreting these images can lead to delayed or incorrect diagnoses, potentially causing harm to the patient and violating professional standards. The CPFDA must possess a thorough understanding of normal radiographic anatomy to effectively identify deviations indicative of pathology. The correct approach represents best professional practice because it aligns with the CPFDA scope of practice as defined by regulatory frameworks governing dental assisting. Specifically, the CPFDA is expected to identify and report radiographic findings that fall within their training and competency, which includes recognizing common pathologies like dental caries and periodontal disease. This ensures that potential issues are brought to the attention of the supervising dentist promptly and accurately, facilitating timely intervention and adherence to patient safety protocols. This also upholds the ethical obligation to provide competent care and act in the patient's best interest. An incorrect approach that involves making definitive diagnoses or recommending specific treatment plans is a regulatory and ethical failure. The CPFDA role is to assist the dentist, not to independently diagnose or prescribe treatment. Such actions exceed the authorized scope of practice, potentially leading to misdiagnosis, inappropriate treatment, and legal ramifications for both the assistant and the dental practice. Furthermore, it undermines the dentist's ultimate responsibility for patient care and violates the principle of professional hierarchy within the dental team. Another incorrect approach, such as ignoring subtle radiographic anomalies, represents a failure to exercise due diligence and a breach of the duty of care. This can result in misdiagnoses, allowing conditions to progress and become more severe, negatively impacting patient outcomes and potentially leading to professional liability. The professional decision-making process for similar situations involves a systematic approach. First, accurately assess the radiographic image against established knowledge of normal anatomy and common pathologies. Second, identify any findings that deviate from the norm. Third, document these findings objectively. Fourth, communicate these observations clearly and concisely to the supervising dentist, highlighting areas of concern. Finally, await the dentist's definitive diagnosis and treatment plan, understanding that the CPFDA role is supportive and observational in the diagnostic process. Question 9. The audit findings indicate that a dental assistant responsible for radiographic procedures has been using a general-purpose cleaning solution to disinfect digital X-ray sensors between patient uses and has been storing them in a drawer exposed to fluctuating temperatures. Which of the following actions best aligns with regulatory compliance and best professional practice for maintaining radiographic equipment? Option A. Using a stronger, hospital-grade disinfectant to ensure thorough sterilization of the sensors and storing them in a cabinet with other instruments. Option B. Following the digital sensor manufacturer's specific instructions for cleaning and storage to ensure optimal performance and prevent damage. Option C. Continuing to use the general-purpose disinfectant as it is effective for most surfaces and storing sensors in a readily accessible drawer to expedite workflow. Option D. Wiping down the sensors with a dry cloth and storing them in a designated area that is not temperature-controlled but is out of direct sunlight. The correct answer is B. Following the digital sensor manufacturer's specific instructions for cleaning and storage to ensure optimal performance and prevent damage. Explanation: the audit findings indicate a potential lapse in maintaining the integrity and safety of radiographic equipment, specifically concerning the handling and storage of digital sensors. This scenario is professionally challenging because it requires the dental assistant to balance efficient workflow with strict adherence to regulatory standards designed to protect patient health and data privacy, as well as ensure the longevity and accuracy of diagnostic equipment. Proper judgment is crucial to avoid compromising diagnostic quality and to prevent potential legal or ethical repercussions. The correct approach, which involves following manufacturer guidelines for cleaning and storing digital sensors, represents best professional practice because it directly aligns with the regulatory framework governing dental radiography. The Certified Preventive Functions Dental Assistant (CPFDA) certification implies a commitment to upholding standards that ensure the safe and effective use of diagnostic equipment. Manufacturer guidelines are often developed in conjunction with regulatory bodies or are considered the industry standard for maintaining equipment performance and preventing cross-contamination, which is a key aspect of infection control mandated by dental practice acts and radiation safety regulations. Adhering to these guidelines ensures the sensor's accuracy, prolongs its lifespan, and prevents potential damage or degradation that could lead to inaccurate diagnostic images, thereby safeguarding patient care. An incorrect approach that involves using general-purpose disinfectants not approved by the manufacturer for digital sensors is professionally unacceptable. This failure constitutes a regulatory violation because it disregards specific equipment care instructions, which are implicitly or explicitly part of the broader regulatory mandate for maintaining equipment in proper working order. Such actions can lead to sensor damage, voiding warranties, and potentially compromising image quality, which directly impacts diagnostic accuracy and patient care. Ethically, it represents a failure to exercise due diligence in protecting patient health and ensuring the reliability of diagnostic tools. Another incorrect approach, such as storing digital sensors in a location exposed to direct sunlight or extreme temperatures, is also professionally unacceptable. This violates regulatory requirements related to equipment maintenance and preservation. Environmental factors can degrade the sensitive components of digital sensors, leading to malfunction or reduced performance. This directly contravenes the ethical obligation to provide accurate diagnostics and the regulatory imperative to maintain equipment in a condition that ensures safe and effective operation. A third incorrect approach, which involves sharing digital sensors between multiple operatories without proper disinfection protocols between patients, is a severe regulatory and ethical failure. This directly violates infection control standards, which are a cornerstone of dental practice regulations. Failure to disinfect adequately between patients poses a significant risk of cross-contamination, jeopardizing patient health. Furthermore, it demonstrates a disregard for the proper care and maintenance of the equipment, potentially leading to its premature failure and compromising diagnostic capabilities. The professional decision-making process for similar situations should involve a systematic approach. 1. Identify the specific equipment and its associated manufacturer guidelines. 2. Consult relevant regulatory frameworks and practice acts for guidance on equipment maintenance, infection control, and radiation safety. 3. Prioritize patient safety and diagnostic accuracy above all else. 4. Implement protocols that ensure both equipment longevity and compliance with all applicable regulations. 5. Seek clarification from supervisors or regulatory bodies if there is any ambiguity regarding best practices or compliance requirements. Question 10. The control framework reveals that a patient requires a sealant for a newly erupted molar. The dentist has instructed the assistant to use a specific brand of sealant that the assistant knows from continuing education to be less retentive and more prone to premature wear compared to other available, similarly priced options. The patient has no known allergies or contraindications to any sealant materials. The assistant is concerned that using this particular sealant may not provide the optimal long-term preventive benefit for the patient. Option A. Proceed with applying the instructed sealant without comment, assuming the dentist has a valid reason for the choice. Option B. Refuse to apply the sealant and insist that the dentist use a different material without further discussion. Option C. Inform the supervising dentist of the concerns regarding the sealant's retentiveness and wear properties, and suggest discussing alternative, potentially more effective, sealant options with the patient. Option D. Advise the patient that the instructed sealant is not ideal, but that it is what the dentist has chosen, leaving the patient to decide if they want to proceed. The correct answer is C. Inform the supervising dentist of the concerns regarding the sealant's retentiveness and wear properties, and suggest discussing alternative, potentially more effective, sealant options with the patient. Explanation. This scenario presents a professional challenge because it pits the dental assistant's duty to provide accurate and safe patient care against potential pressure to use a material that may not be the most appropriate or cost-effective for the patient's specific needs. The dental assistant must navigate ethical considerations regarding patient autonomy, informed consent, and the dentist's ultimate responsibility for treatment decisions, all within the scope of their practice as defined by the Certified Preventive Functions Dental Assistant (CPFDA) regulatory framework. The correct approach involves prioritizing patient well-being and adhering to professional ethical standards. This means clearly communicating any concerns about the material's suitability to the supervising dentist, providing factual information about alternative materials if known, and ensuring the patient receives all necessary information to make an informed decision. This aligns with the CPFDA mandate to act in the best interest of the patient and to uphold the integrity of dental care. It also respects the dentist's role in diagnosis and treatment planning, while empowering the dental assistant to contribute to a safe and ethical patient experience. An incorrect approach would be to proceed with using the material without raising concerns, thereby potentially compromising patient care and violating the principle of do no harm. This could lead to suboptimal treatment outcomes, patient dissatisfaction, and potential disciplinary action for failing to act responsibly. Another incorrect approach would be to unilaterally decide against using the material without consulting the dentist, overstepping the assistant's scope of practice, and undermining the dentist-patient relationship. Finally, pressuring the patient to accept the material without full disclosure of potential drawbacks or alternatives would be a significant ethical breach, violating the principles of informed consent and patient autonomy. Professionals should employ a decision-making process that begins with identifying the ethical and professional obligations. This involves assessing the situation for potential conflicts of interest or patient harm. Next, gather all relevant information, including the properties of the dental materials in question and any patient-specific factors. Then, communicate concerns clearly and professionally to the supervising dentist, offering solutions or alternatives if appropriate. If the situation remains unresolved or ethically questionable, seeking guidance from professional bodies or senior colleagues is advisable. The ultimate goal is to ensure patient safety, uphold ethical standards, and maintain professional integrity. Question 11. The assessment process reveals that during a routine prophylaxis procedure, the dental assistant accidentally drops a sterile scaler onto the floor. The dentist pauses, looking to the assistant for a solution. The assistant has access to a sterile instrument kit and a designated area for contaminated instruments. What is the most appropriate immediate action for the dental assistant to take? Option A. Retrieve a new sterile scaler from the sterile instrument kit and replace the dropped instrument. Then dispose of the dropped scaler in the designated contaminated instrument bin. Option B. Wipe the dropped scaler with an antiseptic wipe and reintroduce it into the sterile field. Option C. Retrieve the dropped scaler and attempt to quickly sterilize a chairside using a high-level disinfectant spray. Option D. Continue the procedure with the remaining sterile instruments, assuming the dropped scaler is not critical for the immediate steps. Correct answer is A. Retrieve a new sterile scaler from the sterile instrument kit and replace the dropped instrument, then dispose of the dropped scaler in the designated contaminated instrument bin. Explanation. The assessment process reveals a common challenge in dental settings, maintaining aseptic technique under pressure. This scenario is professionally challenging because it requires immediate, correct action to prevent patient harm and regulatory noncompliance. The dental assistant must balance efficient workflow with the paramount importance of infection control. Careful judgment is required to identify the breach and implement the appropriate corrective measure without compromising the procedure or the patient's safety. The correct approach represents best professional practice because it directly addresses the breach in aseptic technique in a manner that minimizes risk to the patient and adheres to established infection control protocols. By discarding contaminated items and reestablishing sterility, the dental assistant upholds the principles of asepsis, preventing potential transmission of microorganisms. This aligns with the core responsibilities of a Certified Preventive Functions Dental Assistant, CPFDA, as defined by regulatory frameworks focused on patient safety and the prevention of healthcare-associated infections. An incorrect approach involving continuing the procedure with contaminated instruments would represent a significant regulatory and ethical failure. This directly violates the principles of aseptic technique and infection control, increasing the risk of patient infection. Such an action could lead to disciplinary action by regulatory bodies, patient harm, and damage to the professional reputation of the dental assistant and the practice. Another incorrect approach, such as attempting to sterilize the dropped instrument chairside without proper protocols, is also professionally unacceptable. While the intention might be to save time, it bypasses validated sterilization processes and risks inadequate decontamination, thereby failing to eliminate pathogens. This demonstrates a lack of understanding of proper sterilization procedures and a disregard for patient safety, constituting a regulatory and ethical lapse. Finally, ignoring the dropped instrument and proceeding as if no contamination occurred is a severe dereliction of duty. This demonstrates a fundamental failure to recognize and respond to a critical breach in aseptic technique. It not only poses a direct risk of infection to the patient, but also indicates a lack of professional integrity and commitment to patient care, leading to potential legal and disciplinary consequences. A professional reasoning process for similar situations should involve immediate recognition of a breach in aseptic technique, a swift and decisive action to remove contaminated items from the sterile field, and a commitment to reestablishing sterility before continuing the procedure. This decision-making framework prioritizes patient safety above all else and relies on a thorough understanding of infection control principles and regulatory requirements. Question 12. Compliance review shows that a dental assistant has placed a sharps container in the designated biohazard waste bin, but the container is visibly overflowing and a needle is protruding from the side. What is the immediate and most appropriate action to take? Option A. Immediately secure the overflowing sharps container, place it in a secondary containment bin, and arrange for its immediate pickup by a licensed biohazard waste disposal service. Option B. Carefully remove the protruding needle with forceps and place it into the overflowing sharps container, then seal the container and place it in the designated biohazard waste area. Option C. Leave the overflowing sharps container in its current location and inform the office manager to address it later when there is more time. Option D. Place the overflowing sharps container in the general waste bin to avoid further contamination of the biohazard area. The correct answer is B. Carefully remove the protruding needle with forceps and place it into the overflowing sharps container, then seal the container and place it in the designated biohazard waste area. Explanation. This scenario presents a common challenge in dental practice. Ensuring proper waste management protocols are consistently followed, especially when dealing with potentially infectious materials. The professional challenge lies in the potential for breaches in safety and regulatory compliance, which can have serious consequences for staff, patients, and the environment. Careful judgment is required to identify deviations from established procedures and to implement corrective actions that uphold the highest standards of infection control and waste disposal. The correct approach represents best professional practice because it directly addresses the identified noncompliance by reinforcing the established protocol for sharps container disposal. This aligns with regulatory requirements for preventing sharps injuries and ensuring biohazardous waste is contained and managed appropriately. By immediately correcting the observed deviation and reinforcing the correct procedure, the dental assistant demonstrates a commitment to patient safety, staff well-being, and adherence to legal and ethical obligations regarding regulated medical waste. An incorrect approach that involves simply discarding the overflowing sharps container without further action fails to address the root cause of the problem and violates regulations concerning the safe handling and disposal of sharps. This poses a significant risk of needle-stick injuries to staff and improper disposal of biohazardous material. Another incorrect approach, such as placing the overflowing sharps container in the general waste bin, is a severe regulatory and ethical failure. This action directly contravenes guidelines for biohazard waste segregation and disposal, creating a substantial risk of infection transmission and environmental contamination. It demonstrates a profound lack of understanding or disregard for infection control principles and legal mandates. A third incorrect approach, which involves delaying the disposal until a more convenient time, also represents a failure to adhere to timely waste management protocols. Regulations often specify timeframes for the removal of regulated waste, and delays can increase the risk of container compromise and exposure. Professionals should employ a decision-making framework that prioritizes immediate identification of noncompliance, understanding the specific regulatory requirements for the identified issue, and implementing the most effective and compliant corrective action. This involves a proactive approach to infection control and waste management, regular review of protocols, and ongoing staff education to ensure consistent adherence to best practices and legal mandates. Question 13. The risk matrix shows a high probability of cross-contamination if operatory surfaces and dental unit waterlines are not thoroughly disinfected between patients, yet a senior dental assistant suggests a quick wipe-down with a general-purpose cleaner and skipping the waterline flush to expedite patient turnover. As a certified preventive functions dental assistant, which of the following actions best upholds your professional responsibilities and regulatory compliance? Option A. Follow the senior dental assistant's suggestion to maintain team harmony and expedite patient flow, assuming the risk of cross-contamination is minimal. Option B. Agree to the suggestion but disinfect the surfaces more thoroughly after the patient leaves, while still skipping the waterline flush for that appointment. Option C. Use a general-purpose cleaner on surfaces and a quick rinse of the water lines, believing that visual cleanliness is sufficient to prevent infection. Option D. Politely but firmly refuse the suggestion, explaining that the established protocol for disinfection of operatory surfaces and dental unit water lines must be followed to ensure patient and staff safety and comply with CPFDA regulations. The correct answer is D. Politely but firmly refuse the suggestion, explaining that the established protocol for disinfection of operatory surfaces and dental unit water lines must be followed to ensure patient and staff safety and comply with CPFDA regulations. Explanation. Scenario analysis. This scenario presents an ethical dilemma where a dental assistant is pressured to deviate from established infection control protocols due to time constraints and perceived urgency. The challenge lies in balancing the need for efficient patient care with the absolute requirement to maintain a safe and sterile environment, as mandated by regulatory bodies. The assistant must navigate potential peer pressure and the desire to please colleagues while upholding their professional responsibility to patient safety and public health. Correct approach analysis. The correct approach prioritizes adherence to the established protocol for cleaning and disinfecting operatory surfaces and dental unit waterlines. This aligns directly with the regulatory framework for Certified Preventive Functions Dental Assistants, CPFDA, which emphasizes the critical importance of environmental infection control to prevent the transmission of pathogens. Following the manufacturer's instructions for disinfectants and the recommended contact times is not merely a guideline, but a regulatory requirement to ensure efficacy. Proper disinfection of dental unit waterlines is also a non-negotiable standard to prevent patient and staff exposure to waterborne microorganisms. This approach represents best professional practice because it directly mitigates the risk of healthcare-associated infections, protects patient and staff health, and ensures compliance with all relevant CPFDA regulations and guidelines. Incorrect approaches analysis. One incorrect approach involves skipping the full disinfection process for surfaces and waterlines to save time. This is a direct violation of CPFDA regulations concerning environmental infection control. Failure to adhere to recommended contact times for disinfectants renders them ineffective, creating a significant risk of pathogen transmission. Neglecting dental unit waterline disinfection exposes patients and staff to potentially harmful bacteria, viruses, and fungi, which is a serious breach of professional duty and regulatory mandate. Another incorrect approach is to use a less effective disinfectant or a substitute product not approved for dental operatory use. CPFDA regulations specify the types of disinfectants that must be used and require adherence to manufacturer instructions. Using an unapproved or less effective product compromises the disinfection process, failing to eliminate or inactivate microorganisms as required. This demonstrates a lack of understanding or disregard for the scientific principles of disinfection and the specific regulatory requirements for dental settings. A third incorrect approach is to rely on visual cleanliness alone without proper disinfection. While cleaning is a necessary precursor to disinfection, it does not kill microorganisms. CPFDA regulations clearly distinguish between cleaning and disinfection, with disinfection being a critical step in breaking the chain of infection. Relying solely on cleaning creates a false sense of security and leaves the operatory environment vulnerable to contamination, directly contravening infection control standards. Professional reasoning. Professionals in this situation must employ a decision-making process that begins with a thorough understanding of the CPFDA regulatory framework and its implications for infection control. When faced with pressure to deviate from protocols, the professional should first recall the fundamental principles of infection prevention and the specific requirements for environmental surface disinfection and dental unit waterlines. The next step is to clearly and assertively communicate the regulatory and ethical imperatives for adhering to the established protocols, explaining the risks associated with noncompliance. If the pressure persists, escalating the concern to a supervisor or designated infection control officer is the appropriate course of action. This ensures that patient safety and regulatory compliance remain paramount, even in challenging circumstances. Question 14. Stakeholder feedback indicates a need for enhanced understanding of oral cavity innervation among Certified Preventive Functions Dental Assistants, CPFDA, to ensure patient comfort and procedural safety. During a patient consultation regarding a preventive sealant application on the anterior teeth, the assistant needs to anticipate potential patient sensations. Which nerve branch is primarily responsible for the general sensory innervation of the anterior two-thirds of the tongue, excluding the circumvallate papillae? Option A, facial nerve. Option B, infraorbital nerve. Option C, lingual nerve. Option D, glossopharyngeal nerve. The correct answer is C, lingual nerve. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the Certified Preventive Functions Dental Assistant, CPFDA, to accurately identify the nerve responsible for sensation in a specific area of the oral cavity, directly impacting the safety and efficacy of preventive procedures. Misidentification could lead to patient discomfort, injury, or ineffective treatment. CPFDA must apply theoretical knowledge of neuroanatomy to a practical clinical context, demonstrating a critical understanding of how anatomical structures relate to patient care. Correct approach analysis. The correct approach involves recognizing that the anterior two-thirds of the tongue, excluding the circumvallate papillae, receives sensory innervation from the lingual nerve. This nerve is a branch of the mandibular division of the trigeminal nerve. Understanding this specific innervation is crucial for CPFDA performing procedures that involve the anterior tongue, such as sealant application, fluoride varnishing, or oral hygiene instruction, ensuring they avoid irritating or damaging this sensitive area and can effectively communicate with the patient about sensations. Incorrect approaches analysis. One incorrect approach would be to associate the posterior one-third of the tongue with the lingual nerve. The posterior one-third of the tongue, including the circumvallate papillae, is primarily innervated by the glossopharyngeal nerve, CN Roman 9, for general sensation and taste. Attributing anterior tongue sensation to the glossopharyngeal nerve would be a fundamental anatomical error, leading to incorrect clinical decisions. Another incorrect approach would be to attribute the sensory innervation of the anterior two-thirds of the tongue to the infraorbital nerve. The infraorbital nerve is a branch of the maxillary division of the trigeminal nerve and primarily innervates the skin of the face below the orbit, the upper lip, and the maxillary teeth. Its involvement with the oral cavity is limited to the maxillary dentition and associated structures, not the anterior tongue. A further incorrect approach would be to state that the entire oral cavity is innervated by the facial nerve. The facial nerve, CN Roman 7, is primarily a motor nerve controlling facial expressions and also carries taste sensation from the anterior two-thirds of the tongue, via the chorda tympani branch, and parasympathetic innervation to salivary glands. It does not provide general sensory innervation to the majority of the oral cavity, including the tongue. Professional reasoning. When faced with a clinical question regarding nerve innervation, a CPFDA should first identify the specific anatomical region in question. Then, they should recall or consult reliable anatomical resources to determine the primary sensory nerve responsible for that region. This knowledge is foundational for safe and effective preventive dental care. The decision-making process involves linking anatomical knowledge to clinical practice, ensuring that procedures are performed with an awareness of potential sensory pathways and the risk of iatrogenic injury or patient discomfort. This systematic approach, grounded in accurate anatomical understanding, aligns with the CPFDA ethical and professional responsibility to provide competent care. Question 15. Benchmark analysis indicates that a certified preventive functions dental assistant, CPFDA, is performing a routine oral assessment and observes generalized erythema, edema, and bleeding upon gentle probing of the gingival margins in a patient. The patient reports no pain. Considering the CPFDA scope of practice and the foundational components of the periodontium, which of the following actions best represents the appropriate preventive intervention? Option A. Advise the patient to undergo a gingivectomy to reduce the inflamed tissue. Option B. Recommend the patient use a strong antiseptic mouthwash twice daily and return in 6 months. Option C. Educate the patient on meticulous plaque removal techniques, emphasizing interdental cleaning and proper brushing at the gingival margin, and schedule a follow-up to assess improvement. Option D. Immediately refer the patient to a periodontist for advanced periodontal therapy. The correct answer is C. Educate the patient on meticulous plaque removal techniques, emphasizing interdental cleaning and proper brushing at the gingival margin, and schedule a follow-up to assess improvement. Explanation. Scenario analysis. This scenario presents a common challenge in preventive dental care where a certified preventive functions dental assistant, CPFDA, must interpret clinical signs of periodontal disease and recommend appropriate patient education. The challenge lies in accurately assessing the severity of gingival inflammation and its potential implications for the supporting periodontal structures, while adhering strictly to the CPFDA scope of practice and the regulatory framework governing dental auxiliaries. Misinterpretation can lead to inadequate patient care or overstepping professional boundaries. Correct approach analysis. The correct approach involves recognizing the signs of gingivitis, erythema, edema, bleeding on probing, as indicative of inflammation affecting the gingiva. Based on these findings, the CPFDA correctly identifies the need for enhanced oral hygiene instruction focused on plaque removal at the gingival margin. This aligns with the CPFDA role in preventive functions, which includes patient education on oral hygiene techniques to manage gingival health and prevent progression to more severe periodontal disease. This approach is supported by the regulatory framework, which empowers CPFDA to assess oral conditions within their scope and provide preventive education. Incorrect approaches analysis. One incorrect approach involves recommending a specific periodontal surgical procedure. This is a failure because surgical interventions are outside the scope of practice for a CPFDA. Such a recommendation would constitute practicing dentistry without a license and would violate regulations governing dental auxiliaries. Another incorrect approach is to dismiss the observed gingival inflammation as insignificant and advise the patient to simply rinse with mouthwash. This is a failure because it neglects the clinical signs of disease and fails to provide effective preventive education. Gingivitis, if left untreated, can progress to periodontitis, leading to irreversible damage to the periodontal ligament, cementum, and alveolar bone. This approach violates the ethical duty to provide competent care and the regulatory requirement to address preventable oral health issues. A third incorrect approach is to immediately refer the patient to a periodontist without first attempting to educate the patient on basic oral hygiene. While referral is sometimes necessary, a CPFDA role includes initial patient education for common preventive issues. This approach may be considered a failure if the inflammation is clearly indicative of gingivitis that can be managed with improved hygiene, thereby potentially avoiding unnecessary specialist consultation and associated costs for the patient. It bypasses the CPFDA core preventive function. Professional reasoning. Professionals should approach such situations by first conducting a thorough visual assessment of the gingiva and noting any signs of inflammation or bleeding. They should then correlate these findings with their knowledge of periodontal anatomy and disease progression. The decision-making process should prioritize patient education within the CPFDA scope of practice, focusing on reversible conditions like gingivitis. If the assessment reveals signs of more advanced disease, e.g., significant pocketing, mobility, bone loss, which would typically be identified by a dentist, then appropriate referral to a dentist or specialist is indicated. The CPFDA must always operate within their defined scope of practice and adhere to ethical principles of patient care and professional responsibility. Question 16. The evaluation methodology shows that a patient who has previously had a positive experience with biodoing radiographs for detecting interproximal decay is requesting only biodoing radiographs for their routine preventive examination, despite the dentist recommending a combination of periapical and biodoing radiographs to assess the full extent of potential pathology and bone levels. As a certified preventive functions dental assistant, CPFDA, what is the most appropriate course of action? Option A. Inform the patient that their request cannot be accommodated and insist on the full series of periapical and biodoing radiographs without further discussion. Option B. Explain to the patient the diagnostic advantages of the periapical radiographs in conjunction with biodoings for a comprehensive preventive assessment, and obtain their informed consent for the recommended full series. Option C. Suggest that the patient seek a second opinion from another dental professional if they are unwilling to comply with the recommended radiographic protocol. Option D. Proceed with only the biodoing radiographs as requested by the patient to ensure patient satisfaction and avoid conflict. Correct answer is B. Explain to the patient the diagnostic advantages of the periapical radiographs in conjunction with biodoings for a comprehensive preventive assessment and obtain their informed consent for the recommended full series. Explanation. This scenario presents a professional challenge due to the conflict between a patient's expressed preference and the dental assistant's professional judgment regarding the most appropriate radiographic technique for diagnostic purposes. The dental assistant must balance patient autonomy with the ethical and regulatory obligation to provide care that meets professional standards and promotes patient well-being. The core of the challenge lies in determining when it is acceptable to deviate from a standard diagnostic protocol based on patient request, and when it is imperative to uphold that protocol for optimal patient care and to comply with regulatory expectations for preventive functions. The correct approach represents best professional practice because it prioritizes the diagnostic accuracy and diagnostic yield of the radiographic examination, which is fundamental to preventive dentistry. By explaining the rationale behind the recommended technique and its benefits for detecting early signs of disease, the dental assistant upholds their responsibility to educate the patient and obtain informed consent. This aligns with the CPFDA role in preventive functions, ensuring that diagnostic procedures are performed in a manner that maximizes their effectiveness in identifying potential oral health issues. Adhering to established radiographic techniques ensures compliance with the standards of care expected within the regulatory framework governing dental assistance. An incorrect approach that involves immediately acceding to the patient's request without further discussion or assessment would be professionally unacceptable. This failure would stem from a disregard for the diagnostic necessity of the recommended technique, potentially leading to incomplete or inaccurate diagnoses. Ethically, it undermines the principle of beneficence, as it may not serve the patient's best oral health interests. From a regulatory standpoint, it could be considered a failure to perform duties according to established professional standards, potentially violating guidelines related to diagnostic imaging for preventive purposes. Another incorrect approach, such as dismissing the patient's request outright without explanation or attempting to persuade them forcefully, would also be professionally unacceptable. This demonstrates a lack of respect for patient autonomy and can erode trust. Ethically, it fails to engage in shared decision-making and can be perceived as paternalistic. While it might uphold the technical protocol, it neglects the crucial aspect of patient communication and education, which is integral to effective preventive care and informed consent. The professional decision-making process for similar situations should involve a systematic approach. 1. Assess the patient's request and understand their underlying reasons or concerns. 2. Evaluate the diagnostic necessity of the recommended radiographic technique versus the patient's preferred technique in the context of the patient's oral health status and the goals of preventive care. 3. Clearly and empathetically explain the benefits and limitations of both techniques, focusing on how the recommended technique best serves diagnostic and preventive objectives. 4. Engage in a dialogue to address the patient's concerns and explore potential compromises if appropriate and diagnostically sound. 5. If the patient's request poses a significant risk to diagnostic accuracy or patient well-being, firmly but respectfully explain why the recommended technique is essential, referencing professional standards and the principles of preventive dentistry. 6. Document the discussion and the final decision, ensuring informed consent is obtained for the chosen radiographic procedure. Question 17. The assessment process reveals a need to prepare a Class Roman II preparation on a posterior molar for a composite resin restoration. The dentist has indicated a preference for a material that offers good wear resistance and is manageable during manipulation for this type of restoration. Considering the properties and typical applications of various composite resin types, which of the following approaches best aligns with these clinical requirements and best practices for preventive dental functions? Option A. Choose a glass ionomer cement as the primary restorative material for this posterior cavity. Option B. Utilize a microfill composite resin due to its ease of placement in posterior preparations. Option C. Select a hybrid or nanofill composite resin, ensuring proper handling and light curing according to manufacturer instructions. Option D. Employ a flowable composite resin for the entire preparation to facilitate quick placement. The correct answer is C. Select a hybrid or nanofill composite resin, ensuring proper handling and light curing according to manufacturer instructions. Explanation. Scenario analysis. This scenario presents a common challenge in preventive dentistry, selecting the appropriate composite resin material for a specific clinical application while ensuring patient safety and optimal treatment outcomes. The complexity arises from the variety of composite resin formulations, each with distinct properties affecting handling, curing, and long-term performance. A dental assistant must possess a thorough understanding of these variations to make informed decisions that align with the dentist's treatment plan and adhere to established clinical protocols. Misjudgment can lead to suboptimal restorations, increased chair time, and potential patient dissatisfaction or complications. Correct approach analysis. The correct approach involves a systematic evaluation of the clinical situation, considering factors such as the size and location of the cavity, the occlusal forces expected, the aesthetic requirements, and the specific properties of available composite resins. This approach prioritizes patient needs and evidence-based practice. For a Class I or Class Roman II restoration in a posterior tooth requiring good wear resistance and handling characteristics, a hybrid or nanofill composite resin is often indicated. These materials offer a balance of strength, polishability, and ease of manipulation, making them suitable for load-bearing areas. Adherence to manufacturer instructions for use, including proper light curing protocols, is paramount for achieving optimal material properties and ensuring the longevity of the restoration, directly aligning with the CPFDA role in assisting with preventive and restorative procedures under supervision. Incorrect approaches analysis. Choosing a microfill composite resin for Class Roman II restoration in a posterior tooth would be an incorrect approach. Microfill composites are primarily indicated for aesthetic anterior restorations, where wear resistance is less critical. Their lower filler content makes them less durable and more susceptible to wear under occlusal forces, potentially leading to premature failure of the restoration. This failure to select a material appropriate for the clinical demands constitutes a deviation from best practice and could compromise patient care. Opting for a flowable composite resin for a large Class I occlusal restoration without adequate layering or bulk fill techniques would also be incorrect. While flowable composites are useful for lining cavities or small restorations, their reduced filler content can lead to increased polymerization shrinkage and lower wear resistance, making them unsuitable for primary occlusal surfaces that experience significant chewing forces. This choice neglects the material's limitations and the biomechanical demands of the restoration. Using a self-etching bonding agent with a total etch composite resin without following the manufacturer's recommended protocol would be another incorrect approach. Inconsistent or incorrect application of bonding agents can compromise the bond strength between the composite and the tooth structure, leading to micro-leakage, sensitivity, and potential secondary caries. This demonstrates a lack of attention to detail in material handling, which is crucial for successful composite restorations. Professional reasoning. Professionals should approach material selection by first understanding the clinical requirements of the specific restoration. This involves assessing the tooth's location, the extent of decay, the expected occlusal load, and aesthetic considerations. Next, they should consult available resources, such as manufacturer guidelines and peer-reviewed literature, to identify composite resins that possess the necessary properties. Finally, they must consider the dentist's preferred materials and techniques, ensuring seamless integration into the treatment plan and adherence to all relevant practice guidelines and regulations governing dental assisting. Question 18. System analysis indicates that a certified preventive functions dental assistant, CPFDA, is tasked with documenting a new patient's occlusal status. The patient presents with no immediate complaints of pain, but has a history of bruxism. The assistant needs to accurately record the relationship between the maxillary and mandibular arches in both centric relation and centric occlusion to inform the preventive care plan. Which of the following approaches best reflects the required professional and regulatory standards for this documentation? Option A. Guide the patient to a relaxed, unstrained jaw position to establish centric relation, then observe and record the initial tooth contacts. Subsequently, allow the patient to close into their habitual bite, noting the relationship in centric occlusion, and document these findings using precise terminology according to established dental charting protocols. Option B. Visually assess the patient's bite from the front and assume the occlusion is within normal limits, then record that the patient has a normal bite without further specific documentation of centric relation or centric occlusion. Option C. Ask the patient to bite down hard and record the resulting position as centric occlusion without attempting to establish or document centric relation. Option D. Focus primarily on the patient's reported history of bruxism and document that the patient likely has a Class Roman II occlusion without performing a specific assessment of centric relation or centric occlusion. The correct answer is A. Guide the patient to a relaxed, unstrained jaw position to establish centric relation, then observe and record the initial tooth contacts. Subsequently, allow the patient to close into their habitual bite, noting the relationship in centric occlusion, and document these findings using precise terminology according to established dental charting protocols. Explanation. Scenario analysis. This scenario presents a common challenge in preventive dentistry where a dental assistant must accurately assess and document occlusal relationships to inform treatment planning and ensure effective preventive interventions. Misinterpreting or inaccurately documenting the relationship between the maxillary and mandibular arches can lead to incorrect diagnoses, ineffective preventive strategies, and potentially iatrogenic issues. The CPFDA role requires a thorough understanding of dental anatomy, occlusion, and the ability to apply this knowledge in a clinical setting, adhering strictly to established professional standards and regulatory guidelines for patient care documentation. Correct approach analysis. The correct approach involves a systematic and precise evaluation of the patient's occlusion in centric relation and centric occlusion, documenting findings accurately according to established dental charting protocols. This ensures that the dental team has a clear and consistent understanding of the patient's bite, which is fundamental for identifying potential occlusal disharmonies, planning preventive measures like sealants or fluoride application, and monitoring changes over time. Adherence to these documentation standards is a core requirement of professional practice and aligns with the CPFDA responsibility to maintain accurate patient records as mandated by regulatory frameworks governing dental assisting. Incorrect approaches analysis. One incorrect approach involves making assumptions about the occlusion based on visual inspection alone without confirming centric relation. This bypasses a critical diagnostic step, potentially leading to an inaccurate assessment of the patient's true bite. Ethically and regulatorily, this is a failure to perform a complete and accurate assessment, which could compromise patient care and violate standards for diagnostic procedures. Another incorrect approach is to document the occlusion using vague or subjective terminology without objective findings. For instance, describing the bite as okay or normal, without specifying the type of occlusion or the relationship in centric relation and centric occlusion is insufficient. This lack of specificity hinders effective communication within the dental team and fails to meet the requirements for detailed patient record keeping, potentially violating guidelines for professional documentation. A third incorrect approach is to focus solely on the patient's chief complaint without a comprehensive occlusal assessment. While patient concerns are paramount, a thorough preventive assessment requires evaluating all aspects of oral health, including occlusion. Neglecting this aspect can lead to missed opportunities for preventive interventions or the misinterpretation of symptoms related to occlusal issues, which is a failure to provide comprehensive preventive care as expected of a CPFDA. Professional reasoning. Professionals should approach occlusal assessment with a structured methodology. This begins with understanding the definitions of maxillary and mandibular arches, centric relation, and centric occlusion. The clinical process involves guiding the patient into centric relation, observing the initial tooth contacts, and then allowing the patient to move into centric occlusion. Documentation should be objective, utilizing standardized terminology and charting methods. When in doubt, seeking guidance from a supervising dentist is crucial. This systematic approach ensures accuracy, compliance with professional standards, and optimal patient outcomes. Question 19. Assessment of a dental assistant's understanding of amalgam's composition, manipulation, and clinical applications, considering the regulatory framework for Certified Preventive Functions Dental Assistant, CPFDA. A patient requires a posterior restoration using amalgam. The dental assistant is preparing the materials. Which of the following actions best demonstrates adherence to the CPFDA regulatory framework regarding amalgam? Option A. Disposing of excess mixed amalgam and scrap material by rinsing it down the operatory sink to prevent it from drying out. Option B. Mixing the amalgam by hand in a dappen dish until it reaches a putty-like consistency without regard for specific alloy ratios or trituration times. Option C. Using a standard surgical mask and gloves while mixing and condensing the amalgam without considering specific ventilation requirements or mercury vapor monitoring. Option D. Ensuring the amalgamator is calibrated and the trituration time is set according to the manufacturer's recommendations for the specific amalgam alloy, followed by proper condensation techniques and placement of the mixed amalgam into the prepared tooth. The correct answer is D. Ensuring the amalgamator is calibrated and the trituration time is set according to the manufacturer's recommendations for the specific amalgam alloy, followed by proper condensation techniques and placement of the mixed amalgam into the prepared tooth. Explanation. Scenario analysis. This scenario presents a common challenge in dental assisting. ensuring the safe and effective handling of amalgam, a material with specific composition and manipulation requirements. The challenge lies in balancing the need for efficient clinical application with strict adherence to regulatory guidelines designed to protect both the patient and the dental professional from potential hazards associated with mercury. Accurate knowledge of amalgam's components, proper mixing techniques, and appropriate disposal are paramount. Correct approach analysis. The correct approach involves a thorough understanding of amalgam's composition, specifically its alloy, primarily silver, tin, and copper, and mercury content. It requires precise manipulation according to manufacturer instructions and established dental protocols, which often include specific trituration times and condensation techniques to achieve optimal physical properties and minimize mercury vapor release. Furthermore, adherence to waste management regulations for amalgam, including the use of amalgam separators and proper disposal of waste, is a critical component of best professional practice. This approach directly aligns with the principles of infection control, patient safety, and environmental protection mandated by dental regulatory bodies. Incorrect approaches analysis. One incorrect approach involves disregarding manufacturer's instructions for trituration, leading to improper mixing. This can result in a poorly condensed restoration, increasing the risk of failure and potential mercury release. This failure violates professional standards of care and could be considered negligence. Another incorrect approach is the improper disposal of amalgam waste, such as rinsing amalgam scraps down the drain. This directly contravenes environmental regulations designed to prevent mercury contamination of waterways and is a significant ethical and legal violation. A third incorrect approach is the failure to use appropriate personal protective equipment, PPE, when handling amalgam, such as not wearing gloves or a mask. This exposes the dental assistant and potentially others to mercury vapor, violating occupational safety and health regulations, and demonstrating a disregard for professional responsibility. Professional reasoning. Professionals should approach amalgam handling by first consulting and strictly adhering to the manufacturer's instructions for the specific amalgam product being used. This should be supplemented by knowledge of current dental board regulations and guidelines concerning amalgam manipulation, waste disposal, and infection control. A systematic approach involving preoperative preparation, meticulous intraoperative technique, and postoperative waste management ensures compliance and patient safety. When in doubt, seeking clarification from the supervising dentist or referring to official regulatory documents is essential. Question 20. Comparative studies suggest that while multiple tooth numbering systems exist, a dental assistant's primary responsibility is to ensure accurate and consistent patient charting. In a typical U.S.-based dental practice, which tooth identification system should be prioritized for all charting and communication to maintain clarity and adhere to common professional standards? Option A, the FDI system. Option B, a combination of all three systems based on personal preference. Option C, the universal numbering system. Option D, the Palmer notation system. The correct answer is C, the universal numbering system. Explanation. Scenario analysis. This scenario presents a common challenge in dental assisting where accurate identification and documentation of tooth morphology are crucial for effective patient care and communication within the dental team. Misidentification can lead to incorrect treatment planning, charting errors, and potential patient safety issues. The challenge lies in applying the correct tooth numbering system consistently and accurately, especially when dealing with variations in anatomy, or when communicating with different members of the dental team who may be accustomed to different systems. Correct approach analysis. The correct approach involves utilizing the universal numbering system for all charting and communication related to tooth identification. This system is widely adopted in the United States and is the standard for many dental practices and educational institutions. Adhering to this system ensures clarity, consistency, and reduces the risk of misinterpretation among dental professionals. The CPFDA certification emphasizes proficiency in these fundamental skills, and regulatory frameworks often implicitly or explicitly endorse standardized charting methods for patient record integrity. Accurate charting is a cornerstone of professional dental practice, directly impacting patient safety and the quality of care provided. Incorrect approach is analysis. Using the FDI system for charting and communication in a U.S.-based practice would be a regulatory and ethical failure. While the FDI system is internationally recognized, it is not the standard in the U.S. This deviation from the established practice can lead to significant confusion and errors in patient records, potentially resulting in incorrect diagnoses or treatments. It demonstrates a lack of adherence to accepted professional standards and could be considered a breach of professional responsibility to maintain accurate and understandable patient documentation. Similarly, relying solely on the Palmer notation system for all charting and communication in a U.S.-based practice is also professionally unacceptable. While Palmer notation has historical significance and is still used in some contexts, its widespread adoption for routine charting in the U.S. is limited compared to the universal numbering system. Its use can lead to miscommunication with colleagues and other dental professionals who are more familiar with the universal system, thereby compromising the accuracy and continuity of patient care. This failure to use the most common and understood system within the jurisdiction represents a departure from best practices for clear and effective communication. Professional reasoning. Professionals should adopt a decision-making process that prioritizes patient safety and effective communication. This involves understanding the standard practices and regulatory expectations within their specific jurisdiction. When faced with multiple numbering systems, the primary consideration should be the system most commonly used and understood by the dental team and regulatory bodies within that jurisdiction. If there is any ambiguity, seeking clarification from supervising dentists or consulting practice protocols is essential. The goal is always to ensure that patient records are accurate, unambiguous, and readily interpretable by all involved in the patient's care.